The popularity of benzodiazepines, or BDZs, arose from their weak sedative effects at anxiolytic doses and their low toxicity, unlike other anxiolytics, barbiturates. They do not normally cause fatal or even severe respiratory depression. These are active orally, and although most are metabolized by oxidation in the liver, they do not induce hepatic enzyme systems. It is now realized that chronic BDZ treatment may cause cognitive impairment, tolerance, and dependence. For these reasons, BDZ should only be used for 2-4 weeks to treat severe anxiety and insomnia. They act mainly by the enhancement of gamma-aminobutyric acid, GABA-mediated inhibition in the central nervous system. GABA released from nerve terminals binds to GABA receptors. The activation of these receptors increases the chloride ion conductance of the neuron. The GABA chloride channel complex also has a BDZ modulatory receptor site. Occupation of the BDZ sites by BDZ receptor agonists causes a conformational change in the GABA receptor. This increases the affinity of GABA binding and enhances the actions of GABA on the chloride conductance of the neuronal membrane. The GABA receptor basically belong to the superfamily of ligand-gated ion channels. Other examples are the nicotinic, glycine, and 5-HT3 receptors with 5 subunits. Studies have shown that receptors constructed from alpha and beta subunits respond to GABA. That is, the chloride conductance increases. But for a receptor to respond fully to a BDZ, a gamma-2 subunit is required. More studies suggest that GABA receptors containing the alpha-2 subunit are involved in the anxiolytic action of BDZs and used to treat anxiety. And they also act as muscle relaxants. Whereas receptors containing the alpha-1 subunit are involved in the sedative actions of BDZs, like acting as a sedative treating amnesia. When given intravenously, BDZs have an impressive amnesic action and patients may remember nothing of unpleasant procedures, and BDZ also act as anticonvulsants. Now let us talk about the individual drugs that come under the category of benzodiazepines. Note that most of their names end in sepam. Many BDZs are metabolized in the liver to active metabolites, which may have longer elimination half-lives than the parent drug. For example, diazepam with a half-life of 20 to 80 hours has an active N-dysmethyl metabolite that has an elimination half-life of up to 200 hours. Different BDZs are marketed as hypnotics and anxiolytics. It is mainly the duration of action that determines the choice of drug. BDZs used as hypnotics can be divided into short-acting and longer-acting. A rapidly eliminated drug, for example, temazepam, is usually preferred to avoid daytime sedation. A longer-acting drug, for example, loratazepam, may be preferred where early morning waking is a problem and where a daytime anxiolytic effect is needed. Intravenous BDZs, like diazepam, lorazepam, are used in status epilepticus and very occasionally in panic attacks. However, oral alprazolam is probably more effective for this latter purpose and is safer. Midazolam, unlike most BDZs, forms water-soluble salts and is used as an intravenous sedative during endoscopic and dental procedures. Flumitrazepam, rohypnol, is also water-soluble and famously has been used in bars to spike drinks. Adverse effects. Drowsiness and confusion are the most common side effects of the benzodiazepines. Ataxia occurs at high doses and precludes activities that require fine motor coordination, such as driving an automobile. Cognitive impairment, decreased long-term recall and retention of new knowledge, can occur with use of benzodiazepines. Now, let's talk about contraindications of BDZs. These drugs should be avoided in patients with acute angle closure glaucoma. If taken during pregnancy, benzodiazepines are likely to cause fetal abnormalities, and flurazepam is entirely contraindicated during pregnancy. Benzodiazepines are also contraindicated in individuals with severe liver and kidney disorders and in children who are hyperactive.